right. So I'm not sure who is joining us today, but we're going to go ahead and get started. Welcome to our first Q&A and live Instagram session. We're on Zoom and Instagram, so if you see my eyes darting back and forth, that's what's going on. And since it is my first time, please forgive any sort of trip-ups that I do. We're just going to keep going because we want this to be fun and interactive, and we're going to try to be ourselves. I'm going to ask you to hold questions until closer to the end because we have a fair amount that we're covering. And we're going to start. So hi, everybody. I'm Dr. Alawalia. Welcome to the Infinite Health Zone. This is our clinic here. We're at 490 Post Street in San Francisco, Suite 1233. You can always find us online. We're all over the place. This is Christina.
Hi.
She's a nurse that I have known for many years and works with me here closely in the clinic. So we're going to start talking about IV ketamine treatments today. It's a new service to the clinic here, but it's not new to me or to Christina. We've both been using this drug for quite a while. Not using it personally, but using it in a professional sense.
Yep.
I've been using it for about 20 years in both my anesthesia practice and my pain management practice. I'll take a step back and just start with a little bit about myself, if you don't know who I am and why we're doing this. So I'm an anesthesiologist by training. I went to Stanford. I taught there for about 10 plus years. And my fellowship training is in pain management. So I'm both an anesthesiologist and a pain specialist, but my practice here in this clinic is centered around wellness and optimizing health. And everything we do is sort of chosen in those lenses. So IV ketamine is a treatment that I've been offering for 10 to 15 years and is effective. And what we're going to do is to talk about some of the background today. But Christina, do you want to introduce yourself?
I'm Christina. I'm a nurse that's worked with NITU. How we came together was we used to work in surgery together. So my background is in dermatology and surgery. And now I do work in integrative medicine, and how him and I came to this point is because basically we have the same type of goals. Health and wellness is kind of where we see and want to get people into, and maintain and enjoy life, basically.
Yeah, and have fun. So part of our mission in our clinic is to have fun and to bring joy to health, and health is really fun. Okay, so that's a little bit about us. IV ketamine. So what is it and why do we do it and who's a candidate? We're going to go through some of the nuts and bolts of these things. So IV ketamine is a treatment that we offer. It is an intravenous treatment, meaning we do start an IV, right? So the first time you go to a hospital or a clinic, the emergency room, oftentimes the first thing we do is put in an IV so then we can deliver medications effectively. And the real difference when we do IV treatments is the concentration is much higher of the drug or vitamin that we can deliver. And since I'm an anesthesiologist and Christina is a recovery room nurse, as well as her many other talents, one of our main goals is safety and monitoring and taking care of patients as best as we can and as closely as we can. So when we do the treatments here, we set it up in a way that we are monitoring each patient like they're almost in an operating room setting in the recovery zone. During the procedure, we're checking vital signs, and we're both around, but we'll talk about that in a little bit. But IV ketamine is something that is used to treat chronic pain as well as mood disorders. So treatment-resistant depression, you'll hear, certain types of PTSD, bipolar disease, you have to be really careful. But there are different categories and reasons for treating it. And part of our job and our relationship with you is to make sure you're an appropriate candidate and that we have a team approach to treating you. So we ask that you have mental health professionals involved along with us, to make sure we're all taking care of you as best as we can. I'll hand it over to Christina to talk a little bit about sort of the process of how we work with you.
So if there's a client that shows interest, we'll basically have a consult, usually with Dr. A. And he'll kind of go over the nuts and bolts of and do a consultation and an assessment of you to make sure that you're a good candidate for this treatment. And that may involve speaking to whoever is following your mental health care. And then once the appointment is set, then him or I will greet you when you're actually in the office. We'll go through a checklist of things with you so that way we're all on the same page. And then we'll start an IV, and then we'll get you really comfortable. Cozy, yes. And the infusion will take about an hour or so to infuse because it is done slowly. And then you'll recover for a period of time, anywhere from 15 minutes to a half an hour. It just depends on how you're doing. And we look at different things when we're assessing you. And then we always make sure that you're stable, your vital signs are stable, and somebody's in the room with you all the time. There's always going to be a healthcare medical professional with you during the whole process. You're not left alone. And the difference is, in terms of my experience with having ketamine infusions in surgery centers, our office is much more comfortable and nicer.
Yeah, and it smells good.
Yeah. Yes, it's much more relaxing and just mentally in a very nice place. That's one of them. And him and I have worked together for a really long time. So we're very comfortable with what we do, and we're very professional when we have patients that are going to be going through this infusion, and we go through it step by step, and we'll explain everything to you, and you're our primary concern. So it's always one patient. You're never put in a room with a bunch of people. You're by yourself in your own space.
So I'll talk a little bit about ketamine itself and how it works and why it's different. So ketamine works at a different receptor in our brain and our nervous system. It's called the NMDA receptor, and it involves a neurotransmitter called glutamate. So if you're familiar with, say, opiate medications, it works at a mu receptor, which is different. If you're familiar with sort of the mental health medications, SSRIs, those are serotonin receptors, so those are different. So ketamine works in a completely different pathway, and that's why it's effective, because it's activating different parts of your brain to try to help you with the conditions that we're looking at for your treatment. Okay, so who's a good candidate, right? So I would say almost anybody can be a good candidate if they meet certain criteria. So we have to make sure that your heart is stable, that you don't have heart disease, your blood pressure is stable, and that there's no other sort of, medical issues that are outstanding. So we'll ask for, lab studies, and we'll review your lab studies. We'll go through a complete medical history. This is all done in the consultation prior to treatment. And then we'll be in touch with your mental health team if we're doing this for mental health reasons. So we'd like, either a psychiatrist, a psychologist, a therapist. It could be any of the above. We just want you to have a relationship, and we won't actually start the treatment unless you do. And then the treatment itself involves communication with the team after the treatment is done. So I'm getting a little bit ahead of myself, but the mechanics of using ketamine and how ketamine works is the difference in the receptor type that it activates in your brain. So Christina, if you want to talk a little bit about sort of how we monitor and what devices we use here in the office, I think people would be interested in that.
So during the procedure, your blood pressure will be monitored, as well as your heart. We'll look at your pulse and your oxygen to make sure you're breathing well, as well as your level of consciousness, and kind of where you're at. So there's going to be frequent check-ins. And then after, you'll be continually monitored until you basically exit the office.
Yeah. So we're watching you like a hawk the whole time, making sure everything is going smoothly. So I mentioned that, we look really closely at your heart history. We also look to make sure that you don't have a history of psychosis, or anything that a mental health professional tells us that you're not a good candidate for a treatment such as ketamine. Okay, so those are some of the discussion points and screening tools that we look at. There are certain metrics that we can measure, and if your psychiatrist or psychologist wants you to fill out any surveys during the treatment or after the treatment, we can use that also. Thanks for joining us on Instagram Live. I see a couple people who have joined in. That's great. I'm going to press wave because I think that might respond to you, but let me put on my glasses so I can see who's there. I think I'm waving and hopefully that worked. So we'll do our own waves. So excellent. Hi. So yeah, so monitoring is super important because that's where safety comes in. We're equipped to handle various emergencies that might come up, and the emergencies are very rare that they would come up with ketamine because it's so safe, but we're ready for it. And that's why we also feel so confident doing these treatments here in our office, is because we can handle it. And once you're screened and your lab studies are reviewed, the safety is really great with ketamine because it actually supports your blood pressure and your heart rate, and it doesn't actually stop your breathing, which is what opiates do. So with ketamine, it actually supports that. So it's really good for office use. And if you need oxygen, we also have oxygen available. So what are some of the things, Christina, that people might need to know before they actually come in for the day of the procedure?
So, you'll have to come in with not eating anything for 4 hours prior to. So nothing by mouth, eating or drinking. You'll also have to arrange a ride to pick you up, because though your heart is great, your level of consciousness and everything else may be a little bit off, but we want to make sure you get home and safe to your loved ones. And that's pretty much it. I mean, and somebody has to stay with you, at least for the first few hours, to make sure that you're doing okay.
After the procedure.
After
we're
the
here
procedure.
during the procedure.
Yes.
Yeah. So we'll take care of you here, but when you go home, you do need a ride to take you home and somebody to watch you. And this is all just to be extra safe because, when you get the infusion, it's not like you're out to lunch in terms of being asleep like an anesthetic. We're able to communicate with you, but your mental sharpness might be a little different. So I don't recommend you go buy a car or buy a house or invest or do anything for 24 hours. You may feel really great, but the time to do that is later, once you recover. Sorry, I dropped my glasses. And I'm going to see if there are any questions that are coming up. Okay, none yet. So perfect. One of the other things that I wanted to highlight about our office is that we can do it in treatment rooms where it's private, but we also have cozy chairs. And some people like to listen to their own music, so bring your own music.
Bring your own music.
You can,
or if you have...
Sorry, I guess it's a text.
Eye covers, gel eye covers, anything that helps you, warm socks, that always helps. And think of it almost like you're coming in and you'll rest. You're going to relax. Most people are pretty relaxed after. That's why we don't want you making any important decisions after. And just anything that brings you comfort. We'll, of course, provide pillows and blankets, but anything else that brings you comfort and to kind of zone out a little bit.
Yes, so comfort is important. So the infusions themselves, right? So after you check in for the treatment, and you're in your preferred seating space, will last probably about an hour. It depends a little bit if you're on the mental health pathway for the treatment versus the chronic pain treatments. The pain treatments tend to last closer to an hour and a half to 2 hours. The mood treatments are about an hour. And the frequency changes. So if we're doing a treatment for chronic pain, those are usually more back-to-back treatments, 4 to 5 treatments, and then we'll reassess. With the mood disorder treatments, it's once to twice a week for a series of 3. And again, those infusions are about 1 hour each. And for the chronic pain treatments, those can last a little bit longer. So we estimate, 2 hours in the office, 2 to 3 hours, I think is a good time frame to just have. And we go over all that information when you're here in your pre-op visit with us.
Yeah.
Yeah, but that was a good question. I think that question was actually from Instagram Live. Exactly. And I think there's another question coming in. Wow, we have some very active people.
That's good.
I think it's another doctor who's chimed in. Okay, so the question is about how do you feel, right?
Yes.
So I have never done it myself. You haven't either. Okay.
No.
So I can just tell you what has been reported by literature and also what clients say. So we don't want you to be asleep, right? So it's a little bit in a twilight kind of a zone, right?
Yeah.
So you can be a little bit out of body, like you're floating or hovering. You might not remember things as clearly, but we can communicate with you. So we can ask you, we can be like,
right.
Are you feeling comfortable? And you will be able to reply to us because that is really important for us to monitor you and adjust the dose because we don't want you to be asleep. We don't want you to be anesthetized. We want you to be in a comfortable zone, but just a little bit out of your body.
Most people, it's more of like a relaxed feeling. Because like I said, we'll be monitoring you and checking on you and kind of asking you kind of where you're at and how you're feeling during the process. Because everybody's body is different. And, so we're not gonna, each individual, we're gonna treat on their level and not assume that everybody is the same.
And that goes for dosing, right? Because everyone comes in and asks, what dose do I get started on? And it's based on weight. And then we customize the dose for each person and how you do during the infusion. So if we find while we're communicating with you that you're not communicating back as we'd like you, so we'll reduce the dose a little bit. Or if we find that you're not feeling the effects, we can alter it. And that's why we do a series of these infusions so we can adjust the dose and track and see how you do. So each infusion is customized, each treatment is customized. We do it with the utmost safety. We're both trained to handle any concerns that might come up and really do our best for you. I see another question coming in. So let me just have a look. How long the effects last? The effects, that's a great question. So it really depends on where you are in your treatment and where you are in terms of your mental health issues or your chronic pain. So for some people, the effects, well, our goal is to have it last as long as it can. But for some, it's a week to 2 weeks, but that's why we repeat these doses. So they stack on top of each other to get the results and hopefully last long enough that you need to come back maybe once or twice a year for a boost if you need it. But generally within the first 3 to 4 treatments, we expect to get to a point where you get a good result where you don't have to come back that often.
And just in case the question was in regards to kind of the sensation of feeling really relaxed or anything like that post-treatment or post-infusion, it's going to differ for everybody. Some people, it may last an hour. Some people, they might get it until they fall asleep. I think it's going to depend on everybody because everybody's body is different of how they absorb things.
Yeah, and then another concern that people have is what do they do about the medications that they're taking? If they're taking pain medications or if they're taking mood medications, what do they do? And it's part of the discussion with a treating team, whether we have you stop the medication or not. Usually we continue with it and you continue the next day after the day of ketamine infusion. But, that's why we ask your team to be involved so we can all plan for this for your best outcome.
Yeah.
I think we're getting pretty close to the end, but I just want to shout out to our question asking colleagues. There is Dr. Travers joining us from Dublin, Ireland. Wow. Hi, and we have Dr. Sue joining us from across the bay. Hi, thanks for joining us. And we welcome feedback on this, and we look forward to seeing you next time. Is this safe in pregnancy? So right now, it is not recommended to do these treatments during pregnancy. And we'll end on that. So thanks for joining us,
Thank
and
you.
we'll do this again.